The Legacy of Trauma: Uncovering the Impact of PTSD in Northern Ireland. A haunting reminder of the past. Imagine living with a constant reminder of a traumatic era, even decades after the violence has ceased. This is the reality for many in Northern Ireland, where a recent study has revealed a startling statistic. 1 in 20 over 50s in Northern Ireland are battling PTSD. This figure, uncovered by researchers, sheds light on the long-lasting scars left by the Troubles, a period of civil conflict that ended over a quarter of a century ago. But here's where it gets controversial. Nearly 60% of those with PTSD attribute their trauma to the Troubles, despite the passage of time. Researchers from Queen's University Belfast and Trinity College Dublin emphasise the long-term consequences of civil conflict for older adults. And this is the part most people miss. The study's authors highlight the global relevance of understanding the neurocognitive effects of conflict-related trauma, especially given the rise in armed conflicts and the burden on civilians in modern warfare. The study examined over 2,000 adults aged 50 and above, delving into their physical and mental health experiences during the Troubles and PTSD symptoms. The results were eye-opening. Individuals with PTSD performed significantly worse on memory tests, recalling fewer words than those without the disorder. They also scored lower on general cognitive assessments, indicating a potential link between trauma and cognitive function. The impact of PTSD on cognition. The study's authors state, individuals with PTSD recalled approximately half a word less than those without on tests of verbal recall and scored lower on global cognitive assessments. This suggests an effect of trauma on cognitive function at a population level. PTSD, a mental health disorder triggered by traumatic events, is considered a significant public health concern. Previous studies on veterans and trauma-exposed groups have documented similar links between PTSD and memory impairment. The Northern Ireland study aimed to explore these associations among a representative sample of older adults with high conflict exposure. The findings revealed a PTSD rate of 4.74% among the over 50s tested, which is notably high compared to international estimates. The study also uncovered social patterns among those with PTSD. They were more likely to be in the younger age categories, below 65, have lower education levels, be single, and live in deprived areas. They also reported multiple long-term health issues, higher smoking rates, lower physical activity, and social isolation. One of the strongest findings was the link between the impact of the Troubles and PTSD. Those who reported an extreme impact on their life or community were about 5 times more likely to have PTSD. Similarly, individuals with high depressive symptoms were about 11 times more likely to have PTSD. The study, published in the Social Science and Medicine Journal, found no significant difference between men and women. However, it highlights the need to examine the impact of PTSD on civilians, an area that has been relatively underexplored compared to combat veterans. As the authors state, this is the first study to consider the potential impact of PTSD on cognition in the Northern Ireland population. It's a reminder that the scars of trauma can run deep, even in a society that has moved on from its violent past.